Sound check. Presenter's laptop. Sound check. Presenter's laptop. Sound check. Clerk's laptop. Sound check. Clerk's laptop. Sound check. Presenter's laptop. Sound check. Presenter's laptop.
Mr. Mayor, and we are now live.
All right, thank you. And I'd like to then call this meeting to order. I'm assuming everyone that needs to be here is here, and I'll go this. I'll ask if Councillor Wilson is present, and I do see her. Thank
Happy
you.
New Year, present.
Happy
Thank
New
you.
Year. Councillor Farr. Some, thank you. Councillor Nan.
Present. Good morning.
Good morning. Councillor Marula.
Good morning, Mr. Mayor. Present.
Good morning. Thank you. Collins. Councillor Collins.
Good morning.
Councillor Jackson.
Hoping for a better 2021, Mr. Mayor. Good morning.
As we all are. Thank you. Good morning. Councillor Pauls.
Good morning, Mayor.
Good morning. Councillor Danko.
Good morning, present.
Good morning. Councillor Clark. Haven't seen him as yet. Sure he'll be along. Councillor Pearson.
Good morning, present.
Good morning. Councillor Johnson.
Good morning. Happy New Year, everyone.
Thank you. Councillor Ferguson. I see you. You're still muted.
Do you hear me now?
There, we heard you. Yep.
Okay, Happy New Year.
Happy New Year. Councillor Vanderbeek.
Good morning. Happy New Year.
Good morning. Councillor Whitehead. Not as yet. And Councillor Partridge.
Yes, good morning, Mr. Mayor.
Good morning. Welcome back, everyone, for, yes, hopefully a better year in 2021. I'll turn to Madam Clerk. Are there any changes to this agenda?
Yes, Mr. Mayor, we have, I'm unmuted. We have general information, other business, amendments to the outstanding business list, which are revisions of due dates and an item to be removed.
Okay, thank you. So on the agenda as amended, could I have a motion, please? Thank you. Councillor Nan, seconded by Councillor Johnson. All in favor? The agenda as amended. Electronic vote. Hopefully everyone's able to vote. Let me know if you're having problems. Councillor Collins, thumbs up. Thank you. Did you get everyone? Sorry? Councillor Wilson? Not on the screen at the moment. Okay, that's carried. Thank you. And any declarations of interest? I'm not seeing any indications of that. We have the minutes of the meeting of December the 7th, 2020. Can I have a motion to approve those minutes? Moved by Partridge, second by Marula. Any comments or questions? It's not. All in favor? Electronically.
Mr. Mayor, my apologies, but the power at our home just shut off. So I'm not, if I keep coming and going during the meeting, it's a consequence of that.
Okay, thank you. Hope they get it restored quickly. So vote is up, all in, carried, sorry. Thank you. And on the communications items, item 5.1 to be received is a communications correspondence from the Honorable Christine Elliott, Deputy Premier and Prime Minister of Health, and Dr. David Williams, Medical Officer of Health, with extraordinary one-time funding for COVID-19 extraordinary costs. Any comments or questions on it? Councillor Ferguson, and then Councillor Wilson.
Yeah, thank you, Mr. Mayor. And I just want to thank the province for this again. Just a question to staff. I guess it would be Mike. Does this now keep us totally whole on the COVID-19 costs?
Not sure Mike is on the call, to be honest.
Is there someone from?
But I would.
Maybe I see Dr. Richardson just jumped up. Maybe she knows the answer.
I don't think anyone from finance is here, but Dr. Elizabeth, go ahead.
Thanks very much, Mr. Mayor. It's a good question, Councillor Ferguson. Based on our costs that we submitted as the Q3, it does cover our costs, and we haven't yet hit year end to know exactly where all of our costs lie, but we are estimating that it will cover the public health specific costs fully.
Perfect. Thanks, Dr. Richardson.
Thank you. Councillor Wilson.
Thank you, Mr. Mayor. To Dr. Richardson, just going through this chronologically, if I'm reading the schedules correctly, and I'm sorry, I'm late getting this rebooted. Do I interpret Schedule A that the province initially, prior to the pandemic, cut public health funding by 2.3 million? And if it's giving us that's my first question. If it's giving us 6 million in funding, does that mean 6 million? Does it actually mean 4 million? I'm just trying to understand the whole amount that we're receiving. Thank you.
It's an important question. Sorry, Mr. Mayor.
Go ahead.
Through you, Mr. Mayor. It's an important question about the transition and where we were at. If you remember, we were in the midst of a transition from 75-25 funding, so 75% provincial, 25 municipal, and moving some of our 100% provincially funded programs to an overall 70-30 funding ratio, and that was going to occur over 2 budget years. So we were in the midst of that transition when the COVID pandemic occurred, and so the province committed early on in 2020 that they would not, they would make up that shortfall for municipalities, so municipalities would not have to expend any further resources in order to fund public health. And so that's what the 2.2 million represents, is bringing us back to whole relative to our prior funding formula. And then the $6 million is for COVID costs over and above that.
Okay, thank you. I think, if I recall when I was reading this, there is a reference in around page 14 or 15 of the scheduling about one-time costs in the agreement. Is that amount going towards the payment of overtime that has been incurred to date? Through you, Mr. Mayor.
Thank you.
Through you, Mr. Mayor, all of the expenses that we have incurred that relate to COVID-19 management will be put in against this bucket of funding from the provinces. So that does include a staff overtime. So there are certain funding buckets, however, that said they would cover their own costs. So for example, Healthy Babies, Healthy Children, they said we could utilize staff and resources from that program to assist with this. There are some that have come from other city 100% funded programs that have said that they will be able to cover their own costs. So wherever the province is willing to cover the costs, we're applying that funding to the staffing costs, with the remainder of them falling to this COVID-19 amount that the province is offering.
Okay, thank you. I'm just, if you don't mind, looking at the one-time funding for the new purpose-built vaccine refrigerators. For the folks, it's in Schedule B, page 15. Where will those be housed? Are you able to say that, or would you rather not?
Through you, Mr. Mayor, at this time, the province has asked that in terms of specific allocations and locations, that those be kept private for now.
Okay, thanks, fair enough. And my final question is, I can't find it now, but there's reference to student positions. You've referenced before there, of course, there's a great demand for folks who are schooled in public health. Do you foresee any difficulty in staffing up?
Can't hear you, Doc. You're still muted.
There we go.
Thank you.
Through you, Mr. Mayor, we have had significant challenges in staffing up. As you've noted, Councillor Wilson, public health resources are in high demand across the country, and around the world. And so we do have open postings for a number of our positions, and the province is indeed also assisting with recruiting through an HR firm that they have engaged in terms of helping us with positions that are 100% funded by them. So it's all hands on deck when it comes to recruitment and finding positions, and so we anticipate that will continue to be a challenge for our positions.
I guess if there's only any long-term benefit of this, it perhaps in terms of vocations, it underscores the importance of public health, and perhaps for some young minds will cause them to consider it in their schooling and their practice. Thank you. Those are my questions.
Right, thank you. Much appreciated. Thank you. On the item then, there's a motion to receive. Councillor Jackson, you would like to speak, sir?
Can I?
Okay. Yeah, go ahead.
Yes. Yeah, thanks, Mr. Mayor. So I just want to be crystal clear. This shows with the announcement here in this correspondence, Mr. Mayor, a total of $40,333,200 for Hamilton under the Hamilton Public Health Funding and Accountability Agreement. Last fall, from General Manager Zagaric, we heard consistently, questions I asked, others did, that we have received overall $44 million from the province for COVID-related costs. Are these two separate numbers, or is this 40 million now a revised overall COVID number that Board of Health has received? Because I'm a little bit confused on this, Mr. Mayor. Through you, please.
Thank you.
Through you, Mr. Mayor, I may not be the best one to answer this one. There are essentially two funding streams at least that relate to COVID-19. There is the broader provincial relief that's been offered to municipalities for COVID-19 related costs. That is a separate funding envelope than this funding envelope that we're talking about today. So I'm not familiar with the total size of that funding envelope, and so it may just be happenstance that they end up being in the similar ballpark, but this is specific funding for public health services, and there is the additional funding for overall municipal impacts.
Dr. Richardson, you've made me extremely happy to hear that answer, Mr. Mayor. 44 million plus this 40 million. Thank you, Province of Ontario. Thank you, Mr. Mayor.
Great, thank you. Councillor Nan?
Nice and slow turning that mic on, hey? Good morning, Dr. Richardson, through you, Mayor, on the correspondence from the province, and absolutely welcome news to make us whole as per public health related COVID costs. There was a portion of that in terms of the base funding that speaks to our harm reduction work here in the city. And I believe last year, near the end of our meetings with Board of Health, I had inquired about whether or not we had any updated data on the need for harm reduction during COVID-19 and where we're at in terms of population, statistics in terms of number of people who are using hard drugs, and where we're at from a resiliency model, given the funding and base funding includes establishing a systemic and sustainable community response program that is guided through public health. So I'm happy to take this conversation offline, but I also wanted to get a quick sense from you, Dr. Richardson, if I could, where we're at in terms of those population health outcomes and how COVID-19 is impacting or compounding some of those issues.
Thank you.
Thanks, Mr. Mayor, through you. Absolutely important issues in terms of mental health, drug usage, overdoses, all of those things. And there'll be a little snapshot in the performance metrics that you'll see today. As you know, that's part of what we track as we go forward through the COVID-19 pandemic, is understanding the impacts on those who are most vulnerable and the ancillary impacts that are happening as a result of the control measures that are in place around COVID-19. In terms of the broader picture of what we're doing on that front, perhaps what's best to do, I'll explain as we go through. We're a little strapped right now to bring other reports forward, but I can assure you that there are staff who continue to work in that vein. Michelle, did you want to add anything? Just, I'm not willing to sort of promise a report in the next 3 months, given where we're at, but perhaps Michelle could give you an update.
Thank you.
Yes, thank you. Through you, Mr. Mayor. So we are still seeing, of course, the impacts of substance use in the community, and they are compounded in many ways by COVID. Part of that, of course, being limits with access to service. And so with respect to reports coming forward, we do have a couple of reports coming forward in the coming months. One specifically about what work we've been able to achieve around drug strategy over the past 12 months. And of course, that it has been limited. The other pieces around decriminalization and what that would look like for our city. So those are coming forward. And Councillor, I'm more than happy to speak with you as well offline with respect to the plans we've been trying to put in place to sort of counterbalance what's happening in the community.
Thank you. Much appreciated from both of you. And yeah, I will follow up. There was good news before the end of the year in terms of additional funding for Urban Core and the work that they're going to be doing with their new site, but that's a number of years away. And I understand, and my concern is from a transitional period and the fact that we're still looking for our site from a public health perspective. And what we're observing in Ward 3 is a concentration geo-specifically in certain neighborhoods and pockets. So happy to take the conversation offline. Just want to make sure that the localized supports are sustainable for the community, and seeing some of those numbers change is quite troubling. Thank you.
Great, thank you. On the communications now, this is so we are going to have a broader COVID-19 update right after this, hopefully covering a lot of the detail that we've already gotten into. So there was a motion to move and approve, receive the communications. Electronic vote, please. Yeah, we had it earlier, and I think it was Marula and Partridge, as I recall it, but don't quote me on that. Okay with that too. All right, thank you. Thank you. Thank you very much. That's carried. On to staff presentation, which is the overview of COVID-19 activities in the City of Hamilton. And as you well know, yesterday a particularly good day, and I want to congratulate Dr. Richardson and her entire team. I know it was a bit of a journey to get to where you were yesterday, but congratulations. Good news that we're not only having vaccinated many long-term care employees, we're now looking to vaccinate all long-term care and retirement residents over the next 8 days, and that's spectacular news. So, Doctor, thank you. Please pass on my gratitude to your entire team. I'm going to turn it over to you to provide any additional information on all of those updates.
Thanks very much, Mr. Mayor. Indeed, it was a very positive day yesterday, a great ray of sunshine in what has been a long year, and it's going to be a bit of a long winter, I'm afraid. Of course, when you're talking about my team, it is my public health team, my colleagues, but it's also my team, which is our Hamilton health system, who is doing all of this work. We have the Hamilton COVID response table. I'll just remind you, with hospitals, primary care, our long-term care, paramedics, everybody is at the table, and it is all of us working together as one team that is making the difference on these and working together to get these vaccines out, as well as control COVID to the best extent that we can. So I've got a rather lengthy presentation for you today. It's, a lot happens in a month when it comes to COVID-19, as you know, and we have both the disease control front that is moving forward, and want to talk to you about where things are at from that perspective, as well as talk to you about the vaccination program, where it's at, where it's going, and the plans from here. Overall, a very dynamic situation. It continues to be now on the two fronts. And it's just, as I said, great to have these partners working on it with us. I'm going to bring up this PowerPoint. It is about 30 slides, well over the guidelines for council presentations, but if you can consider it a number of presentations that we've linked together. I do have a number of my colleagues that are joining me today, not only Stephanie, who you're accustomed to seeing present, and who's going to go over the numbers with us, but also with us today, Michelle Baird, who you know well from our Director of EWCDC. She's going to be addressing the vaccine program, along with Jen Vickers-Manson, who is our Planning Chief in IMS, and has been working on the sequencing work around the vaccine with Kathy Risden, who's also here. She's a physician and a professor in the Department of Family Medicine, and of course one of our colleagues who works across the street at David Braley from City Hall. We also have with us Julia Kalachevich, who is an ethicist who works at a regional level with Ontario Health, with a number of different committees, and is working with us on the sequencing as well. So you're going to see all of us. We're going to trade off as we go forward, and it's a little tricky to do when we're not all in the same room, but we'll go through this virtually. So I'll just start sharing the PowerPoint with you. There we go. So as I said, we're going to run through the overall status update just to give you a sense of all the things really that are going to come and where things are at, and then we'll go through the details through the provincial response framework and metrics as we've showed you each of the last couple of meetings. We'll go into the COVID-19 situation report with the case activity and outbreak activity that Steph is going to share with you. We'll have a little bit of information on the COVID-19 variants and a few other updates from our partners around that Hamilton COVID response table. Give you a sense of where we're at on staffing and recruitment, as you were asking about, Councillor Wilson, just a moment ago, and then spend a fair bit of time on the COVID-19 vaccination program. So overall, we have got, of course, an increasing number of cases that continue to occur and an increasing number of outbreaks. And Steph's going to give you those specific numbers, but do want to make sure you're aware that it has impacted our ability to follow up with cases and contacts in a timely manner. And you'll see that in our metrics in just a moment. And so our approach to case and contact management has been revised to focus on areas where we can have the greatest impact in the work that we do. So that is in isolating new cases, so speaking with them and making sure that they're in isolation and they have the things they need to stay in isolation. It is in following up with the highest risk contacts to ensure that they're quarantined and to check in with them if they're becoming ill. And as well, of course, it is in outbreak response, especially in our congregate settings in long-term care homes, retirement homes, and the like that we continue to see outbreaks in. Do want to make you aware that this does mean that we are not collecting the extent of data that we once were. And in fact, the province recognizing these issues is putting together a set of expectations for minimum requirements for case and contact management. We don't yet have those, but that will include a minimum set of data that they're asking be collected. And this does mean that some of the more detailed social determinants of health data is not being collected at this time. As my colleagues around the table remind me, we have the patterns that we have seen, both in terms of disease transmission, who is the highest risk, where transmission is occurring, and those who are most affected, including those who are most vulnerable. Those patterns have been well established now for some months. And so we will go back to collecting those data when the disease cases and contacts comes back down, but for now we're just not able to do that and do the both the outbreak management work and of course now the vaccine provision work that we're needing to do. So our vaccine program, as you've heard, is underway. We are following the frameworks and ongoing guidance that is provided by the province. So just what you're going to hear about is a lot more on that in the coming few minutes, but the province is very much continuing to give us guidance, give us frameworks, whether they be ethical frameworks or prioritization, with various degrees of granularity as we go forward. We did, of course, begin vaccination in our Hamilton Health Sciences fixed site clinic just before Christmas time on December 23rd. And then we began vaccination in our long-term care homes and high-risk retirement homes yesterday, thanks to a wonderful group who got this off the ground very quickly once it was, we had the guidance on how the Pfizer vaccine could be moved. And so we aim to complete those long-term care homes and high-risk retirement homes by January 18th, so a week from today. It is a very dynamic situation with very short cycles of planning. We're really in the particularly around the vaccine program, we're really planning for 2, 3, 4 days out with a view to the longer term future. But because both as further direction comes from the province as well as further vaccine supply comes, as well as the evolving science around things, for example, as to how much protection do you get with 1 dose of vaccine versus 2, all of those sorts of things are very quickly evolving at this time, and so we are making decisions in the time frame with the best information that we have, but knowing that there will be more information and a need to review and make longer decisions as we go forward. In terms of this framework, I'm sure you're all very familiar with this at this point, and you're all very familiar with the fact that the whole province is in this lockdown gray measures category. You may have heard as well that the Premier has said that he plans to come forward after discussions with Cabinet with further measures later on during this week, and that they are just finalizing what that might look like. And so we are expecting some announcements around that this week. On the indicators, and you'll remember these are the indicators that we've put forward. Some of them are required by the province. These have been discussed and worked out with our Hamilton COVID response table, and they are color-coded to show which category of that response framework they belong with. So our weekly incidence rate per 100,000, of course, went steadily up over the latter part of December to the point where we're sitting at about 160 cases per 100,000 population per week. And that, of course, has been an increasing trend. We kind of went up to 40 in November, then we went up to about 100 in the middle of December, and then we were up to 160. Our percent positivity of the tests that are done in our area sits now at about 6.3%. You'll see that that's well into the gray zone as well, and that percent positivity in the number of cases is what's making it very challenging in terms of doing the follow-up on the cases. Our effective reproduction number, which is essentially a number we want to see below 1, because a number above 1 means the outbreak is continuing to grow. A number below 1 means we can get this outbreak under control. And so that number is currently sitting at 1.16, and again has been on an upward trend. In terms of the proportion of cases that are community acquired versus contact related, this is part of the data, and this is what you'll see in certain spots throughout that we're no longer able to collect in a timely enough way in order to comment on that and track that. Overall, though, we do have a high number of outbreaks amongst long-term care homes and retirement homes. On Friday, we had 32 active outbreaks, with 9 of them having more than 10 cases. From a public health system capacity, if I haven't said it already, you've just heard it, it's very stretched. We are reaching the newly reported cases within 1 day of the reported date about 48% of the time, with all of the added resources, which I'll speak to in just a minute. While that is creeping up, and we have made many process changes and CQI changes and in order to try and get to as many as possible as quickly as possible, we're just at that state, as you heard me say, where we're doing the best we can, but we're not able to get to all or collect the data on all. In our health system partners continue to be stretched. As you'll see here, the overall occupancy rates are at that sort of 100% mark. The good news is that with the opening of the ALC beds that St. Joseph's and Hamilton Health Sciences were able to get funded and get open here in the community, that their ALC bed levels are down. However, their ICU, just as we're hearing across the province, their ICU occupancy is up at sitting around the 80 to 90% mark. So at this point, I'm going to turn it over to Steph and have her go through for you the case activity and outbreak activity. And Steph, you just let me know what you'd like me to do in terms of the slides.
Okay, thanks very much, Dr. Richardson. Good morning, everybody. Happy New Year. Similar to my previous presentations, my case summary will be broken up into the same 2 parts: an overview of case activity followed by outbreak activity. And also similar to my previous presentations, the information in this presentation is current as of last Friday morning. If I could just ask you to move to the next slide, Doctor. Thank you. So starting off with part 1, case activity. Thank you. So building off of what I presented to you in the December Board of Health meeting, I've broken down case activity of Wave 2 into phases once again. Phase 1, which is that pre-peak phase in September of 2020. During this period, we saw cases primarily due to people being in contact with other known cases of COVID-19, and also cases with undetermined sources, so those community acquired. Socialization and household spread were key drivers behind the increases in our case activity. When looking at the case statistics during this phase, we had a total of 179 cases reported to Hamilton Public Health, 1 death, and 6 cases hospitalized. Testing volumes were high at the time, with a total of 25,220 tests completed at the Hamilton assessment centers. Phase 2, so kind of peak 1 in October 2020. During this phase, outbreak activity rose sharply, so which contributed to the spread of COVID-19. 27 COVID-19 outbreaks commenced. The large outbreak, which occurred at Spinco, triggered a large peak at the very beginning of the month. Many cases during this period also occurred due to contact with other known cases of COVID-19 and also undetermined sources. Also during this phase, many factors led to ongoing risky behaviors, which resulted in the consistent increase in case activity in Hamilton. These factors include choice, stigma, and structural barriers. When looking at case statistics during this phase, we had a total of 691 cases reported to Hamilton Public Health, 2 deaths, and 17 cases hospitalized. Furthermore, there were 27,943 tests completed at Hamilton assessment centers. So looking at phase 3, that's peaks 2+, and that's been from November 2020 through January 8th of 2021. During this phase, case activity increased steeply and outbreak activity continued to rise. 117 COVID-19 outbreaks commenced, with impacts felt notably in long-term care homes. As a result of this, there was also a rise in severe outcomes, including both hospitalizations and deaths. The large outbreaks which occurred at several facilities triggered the peaks throughout this period. Notably large outbreaks during this phase included those at Chartwell Willow Grove, Grace Villa, Juravinsky Hospital, and Shalom Village, amongst many others. Cases during this period continued to occur also as a result of contact with other known cases of COVID-19 and also undetermined sources. And case activity continued to rise as a result of various factors which led to risky behaviors, as I previously described for phase 2. When looking at case statistics during this phase, there was that drastic increase compared to phases 1 and 2 of wave 2, as shown on this slide. There's a total of 5,343 cases reported to Hamilton Public Health, 148 deaths, and 298 cases hospitalized. Furthermore, there were 71,415 tests completed at the Hamilton assessment centers. Dr. Richardson, if I could just ask you to move to the next slide.
Sorry, Steph, it's just being tricky. Doesn't want to move. Give me 1 second.
Sure.
There.
Thank you. So this graph here displays the number of COVID-19 cases reported to Hamilton Public Health Services per day. Overall case activity has continued to increase throughout wave 2. At the very beginning of September, the number of cases reported to Hamilton Public Health was roughly 1 per day. However, this has been steadily rising, as you can see in the graph. The number of cases reported per day as of last Friday was approximately 135 cases. Dr. Richardson, if I could ask you to move to the next slide. Thank you. So here I've broken down the percentage of cases by age by month. Again, this graph builds off of the one that I presented to you in the December 2020 Board of Health meeting. When looking at the percentage of cases by age group in September, so that's that first category in the graph, the blue bars, which corresponds to phase 1 in the phases slide that I just presented. The largest proportion of cases was amongst 20 to 29-year-olds, and the smallest proportion was amongst those aged 80 plus. This noticeably shifted throughout wave 2. So during the November 2020 through January 2021 period, that's that third category created in the graph, that the gray bars, which corresponds to phase 3 from the phases slide. The largest proportion of cases was amongst those aged 20 to 29 years of age again. However, the smallest proportion of cases was amongst those aged 0 to 9 years. And the percentage of cases in those aged 80 plus noticeably rose between September 2020 through January 2021. So if I could just ask you to move to the next slide there. Thank you. So just moving to section 2 now, outbreak activity. So these pie charts here display the total number of COVID-19 outbreaks which have been declared per facility type in wave 2 thus far. Overlaid on the pie slices are the total number of cases associated with each facility type. A total of 146 COVID-19 outbreaks occurred between September 1st, 2020 and January 8th, 2021. The number of COVID-19 outbreaks by facility type have been broken into 2 periods and therefore 2 pie charts, as you can see here on the slide. So September 1st through October 31st, 2020 on the left, and November 1st, 2020 through January 8th, 2021 on the right. The purpose of this was to assess any changes in affected facility types throughout wave 2 thus far. A shift was observed in affected facility types from earlier on in wave 2 in comparison to more recent months. From September through October, so the pie chart on the left, a total of 29 COVID-19 outbreaks were declared. During this time, the majority of outbreaks occurred in long-term care homes and workplaces. In comparison, from November through January 2021, so that's that pie chart again on the right, 117 COVID-19 outbreaks were declared. During these more recent months, the proportions of declared COVID-19 outbreaks in long-term care homes and workplaces decreased slightly, while the proportion of declared outbreaks in schools, daycares, and retirement homes increased. Lastly, on this slide, it's important to note here that although the number of COVID-19 outbreaks declared in long-term care homes, retirement homes, workplaces, and schools, daycares have all been high, certain facility types are more adversely affected than others. So the number of cases per long-term care home and hospital outbreak were high in comparison to the number of cases per workplace and school daycare outbreak, which were low. And the number of cases per outbreak can also be seen in the table that I'm going to show you here on the next slide. Thank you very much, Dr. Richardson. So there have been a total of 1,439 cases associated with COVID-19 outbreaks in wave 2 thus far. So outbreaks which have been declared between September 1st, 2020 and January 8th, 2021. Most of the outbreak-related cases in wave 2 have been associated with long-term care homes, and so that has been 814 cases. A larger proportion of cases in wave 2 thus far have been residents or patients or patrons or student cases. So that's 733 cases. This is greater than the total number of staff cases, which is 682. There have been many outbreak-associated deaths thus far in wave 2. The vast majority of these deaths have occurred in long-term care home residents, with a total of 105 resident deaths between September 1st, 2020 and January 8th, 2021. And lastly, I will once again highlight on this slide the difference in number of cases per facility type. there have been a high number of cases per long-term care home and hospital outbreak, and a low number of cases per school, daycare, and workplace outbreak. And I will pass it back to you, Dr. Richardson.
Thanks very much, Steph. So just a moment to pause and talk about the COVID-19 variants, which I know are something that are of concern around the globe as we are moving forward with this. And we do know that viruses do evolve and change. And so there's ongoing what we call genomic surveillance of viruses around the world to detect any sorts of change that happened. The UK variant that was detected happened after they saw a rapid increase in COVID-19 cases. And so they were seeing that there was more spread. There was a spread of about 15% versus 9% associated with some particular cases then. And so they took a very good look to see if there was any changes, and they did notice that a variant seemed to be responsible for those. And that increase had been ongoing as of this past month. South Africa also, in doing their routine genomic testing, they did detect a variant as well in December of 2020. And as I said, the data seems to say that these strains may be more transmissible, so they can be more easily spread from person to person. So far, the analyses that are being done, it doesn't appear there's any increased risk for hospitalization or that you're more likely to get reinfected with these variants. And similarly, there's no indication that the vaccines that have been produced will be less effective against these. But this, of course, is the subject of ongoing study as we move forward. And as of January 5th, when we last had an update on these, there had been 9 cases of the UK variant identified in Canada, with 6 of those being in Ontario. In terms of our response table and the things that are going on around the city, around our health services organizations, you'll recall that our assessment center hours have been extended because of the increased demand that happened in December, and residents continue to be able to access COVID testing within a day. And there is certainly more openings on day 2 and whatnot, so it's very good in terms of their ability to access the tests. Our ongoing support across the system to congregate settings like long-term care homes, retirement homes who are in crisis is challenged by 2 things. One is the lack of health human resources that exist across the system, very much the same phenomenon that we were talking about earlier, in that there's been a high demand for trained health human resources. And of course, by the size of large outbreaks, because when there are outbreaks in place, then the requirement for the number of staff who are on hand and the number of procedures that need to be done in terms of cleaning and personal protective equipment and whatnot is very high, and so it produces an extra pressure on the system. There are, the province introduced mobile emergency support team funding and a framework for them earlier towards the end of last year. And essentially what it does is provide funding for organizations to bring together volunteers from across various health settings who would want to support the response. Oh, I see it's being tricky again. And it's gone forward on me now this time, Steph. There we go. So they're actively recruiting staff, but again, due to the shortage of staff overall, it is a long process to get those teams together. We do continue to work with the Chamber of Commerce and the business improvement areas to support businesses in their understanding of and adherence to provincial guidelines and in creating safe work environments. As you know, that's been a focus of our IPAC teams, as well as our MLE folks in terms of interpreting the guidelines and legislation. And we're also looking at procuring a forecasting tool that will help us assess the pandemic trajectory so that we can plan more so locally and look at the impacts of various measures and what we might expect as we go forward. From a staffing perspective, we continue to have 263 public health services staff and 8 city staff supporting the COVID response. The demands on staff continue to be very significant, with significant amounts of overtime acquired, but also just the ongoing pressures and issues that they're dealing with in a 7-day-a-week, 12+ hour a day work week that they are working in. We have had to deploy additional staff since late December in an attempt to keep up with the increasing number of cases. We did move over 21 public health nurses and 2 public health leaders to support those nurses in the COVID-19 response from our usual business operations. So that's the reason for those numbers going up. As well as, you know, we've had additional support from the province, from the Ministry of Health. We have 11 case management staff that started as of January 4th. And as I noted earlier, the province is actively trying to recruit more for us to assist us. And as well, we have 33 contact tracers who are provincial or federal government employees who work to support our response. With this, I'm going to turn it over to Michelle to talk about the vaccine.
Okay, so I'm going to start from a place of just taking us back. I think that we've talked a bit about this previously, but to remind us where we are. So we're right now squarely within phase 1, which runs from December 2020 till March 2021, and then we'll move into phase 2 and phase 3. These are the provincial phases for vaccine distribution within the province. So we're in a place right now where we do have Pfizer vaccine available in Hamilton, and you'll know we've been using Pfizer vaccine both on site at a fixed site clinic at Hamilton Health Sciences, and we've moved Pfizer vaccine now slides jumped out. Pfizer vaccine successfully out into long-term care. We do anticipate receiving Moderna vaccine this week. So at this point in time, our focus really is on long-term care home staff and residents. The resident piece, of course, just beginning yesterday. From a staffing perspective right now, we have upwards of 3,000 of our staff from our high-risk retirement homes and long-term care receiving their first dose of vaccine. You'll see the priority populations for phase 1 include those residents and staff, healthcare workers and those working in healthcare settings, First Nation communities, our urban Indigenous population, and then those adults who receive chronic home health care. And you're going to hear a little bit more about sequencing and prioritization in the slides to come. As we move into phase 2, it really is going to continue this group of priority groups, but also broaden. The other piece that we're anticipating that's going to happen in phase 2, so once we get into that April time period, is in addition to the Pfizer and Moderna products, there will be other vaccine products available. Both the Pfizer and Moderna products come with some complicated storage and management requirements. The Pfizer product in particular is at an ultra low temperature freezer where the storage occurs, and it needs to be reconstituted. So there are some challenges. We do anticipate as additional stock becomes available, it'll be vaccine that's more of our usual supply where we see the 2 degrees to 8 degrees refrigeration temperature. When that happens, we anticipate then we can move into a more usual vaccination site inventory, if you will. So we move into primary care and pharmacy once we have vaccine that's more easily to manage. Finally, at the end of the year, as we come into phase 3, vaccine is going to be available at that point in time for anyone who wants to receive it in the province. Staff or Dr. Richardson, maybe? There we go. No? Yep. Okay. So as of January 10th, there have been approximately 5,800 vaccines administered in Hamilton. This includes yesterday in long-term care, we successfully administered 139 doses to our residents for the first time. So the current fixed site vaccination clinic, as I mentioned, at Hamilton Health Science continues to operate, and they are administering right now Pfizer vaccine at that clinic. And this week, we'll have our first Hamilton residents who are long-term care home workers will begin receiving their second dose of vaccine, so fully vaccinated for the first time. We do have those mobile clinics underway. These are like the fixed site clinic, a very collaborative endeavor. They're put together with our public health services staff. We have a group of primary care physicians as well as Hamilton paramedics that are operationalizing these clinics. Over the period of the next week, we're looking at immunizing 4,960 residents approximately. So you can imagine that it does take a coordinated work force to make this happen. As of January 10th, as I said, just over 3,000 of our of 6,200 staff and essential caregivers have received vaccine. We're also hoping that over the next week or two, that number will, of course, continue to increase. From a planning perspective, we are in a place right now that we're putting together a comprehensive plan that will go to the Ministry of Health that outlines basically over the coming year, what does the vaccine plan look like for the city of Hamilton? Right now, we're in that very narrow priority group, but as we continue through the phases, as you'll see, certainly that will broaden. Our plan will include what populations will be vaccinated over which phase in time. We will have a prioritization and ethics plan. You're going to see a little bit about that in the slides to come. We also have a plan with respect to how we're going to measure the effectiveness, evaluate our plan, and of course monitor as we go, just to ensure that we are reaching the targets we set for ourselves and reaching correct populations. A communications plan will support the work of the vaccine operations. And we're going to look at a strategy to address vaccine hesitancy, including health promotion, the use of vaccine champions, and how we use our comms in a way to support vaccine uptake across the city and across all of the populations. There will, of course, also be plans for, maintaining security, transporting vaccine, and those kinds of pieces. Jen, am I bringing this one over to you or to, I think Dr. Kathy Risden is going to speak to this piece?
That's right. Thanks, Michelle.
Thanks, Michelle. Good morning, everyone. Just wanted to spend a few slides explaining in a bit more detail the prioritization process for the vaccine. As you can imagine, in the early stages of the rollout, there is less doses of vaccine than there are people who would like to receive it. So the province has been issuing some very, very clear focused direction on how the initial phase of vaccine rollout will come. You've seen these populations before, I'm sure. The key vaccines for phase 1 are going to all of the groups that Michelle and Dr. Richardson have been describing: residents, staff, essential caregivers, and other employees of congregate living settings, focused right now on long-term care and retirement homes, especially those providing care for seniors, as we know that seniors are at higher risk of infection and serious illness from COVID-19. And the very first thrust of the vaccine campaign has been to try to protect people who are at the most serious risk of very bad outcomes, including death. Healthcare workers are also planned for in this first phase, as are adults in Indigenous communities, including remote communities where the risk of transmission is high. And finally, adult recipients of chronic home health care. On the healthcare worker front, the vaccine is strongly recommended for all workers, but remains a voluntary vaccine right now. So that comms program that Michelle alluded to is really focusing on all of these phase 1 populations to make sure everyone has the information and the confidence of the vaccine they'll need to make an informed choice. We certainly are seeing a lot of uptake from healthcare workers in the hospital sector, especially. All of them post their vaccination shots on Twitter. So that kind of influencing and reassuring people that the vaccine safety is actually really important. Next slide, please. So again, I think some of this information is becoming familiar as we look at the plans for vaccine rollout over the next phases. Michelle just spoke about where some of these vaccines will be delivered. So I don't want to belabor this point, but it is exciting to anticipate phase 2. We are planning for that already, where the vaccine will be more distributable, and we can sort of really start to increase the velocity of vaccination. And just to highlight the point that anyone who is eligible in phase 1 who wasn't able for whatever reason to receive the vaccine, well, we will always have the doors open for those people to catch up at any subsequent point. We are working hard to understand the epidemiology in Hamilton and to identify those who we will be sequencing at near the top of that phase 2 process. And again, just to reiterate Michelle's point about phase 3 coming not soon enough to where vaccine will be very widely available. And I think over to you, Dr. Kurachevich.
Good morning, everyone. So this is going to be next couple of slides talking about how we are prioritizing within the phase one. As of now, that has been several times repeated that there is not enough vaccine at this moment, so we need to focus on the priority populations. And this prioritization and sequencing of the groups is really about achieving overarching goals of the immunization, which is to reduce serious illness and death in these groups and beyond, and preserve healthcare and hospital capacity. The province, as you have already heard, had very directive and prescriptive guidelines. That includes description of the roles and responsibilities for prioritizations between the province and local organizations and agencies, how these priorities have been set, what are the targeted populations and what are the priority populations. And the documents that province have released have very consistent approach to how to actually achieve this fairly complex process. Next slide, please. And in the first weeks, as you have already heard, there are a very specific direction around who should be the recipients of the immunization, and that were congregate settings for seniors. And in the city of Hamilton, the start points were with healthcare workers in the long-term care homes and high-risk retirement homes. The supporting documents that have been released on December 29th by the Provincial Vaccination Task Force includes ethical framework for COVID-19 vaccine distribution. This document is overarching document that help us understand how to balance different priorities and duties that all of us have in our different roles. And the task force has identified 5 principles. Those include minimizing harms and maximizing benefits, striving for equity and fairness in distribution of vaccines, that the prioritization is based on a principle of legitimacy, so best available evidence and data that we have, and that the process is clearly transparent to everybody, including in the process, but also beyond, to the populations that are immunized. And the underlying principle, all this work is to ensure the public trust, that everybody understands and trusts the decisions that are made at different level. To help us, especially during the phase one, the province has released a guidance for prioritizations of healthcare workers. And we know, as Kathy and Jan and everyone else on this call already alluded, we are already in the planning stages for phases 2 and 3. So we are looking in future how to do this while upholding all of these principles. Thank you. Next slide. And this is the framework, the snapshot of the framework that I have been talking about. It is available online, and the presentation, I understood, will be shared. So you can always look in more details into that. Thank you. Next slide. And I am passing to Jen.
Thanks, Dr. Kalachevich. So this is just embedded in the documents from the province, recognizing that it's really going to take all of us at many levels, both locally and provincially and across our city, to achieve our goals. The province has put forward a very clear document on who has which roles and responsibilities. So you can see here the Ministry of Health has a responsibility to set priority populations and sequence for vaccine utilization, determine vaccine allocation for each region or area, and set targets and timelines. On the other hand, the Public Health Unit has a responsibility locally to lead vaccination programs. We're responsible for the process of deciding sequencing of vaccines, and that we're ensuring a consistent application of the provincial priority tools in doing so. A really strong component of this, a necessary component, is engaging with stakeholders to inform our local decision making. So really understanding, as we've talked about so far, some of the hesitancy issues and barriers to accessing vaccines for some of our vulnerable populations. In addition, our healthcare organizations really are on for supporting and facilitating the vaccine clinics. As Michelle has said, it really is all hands on deck from across our health sector to really achieve our vaccination. And I'll hand it back over to Dr. Kalichevich.
Thank you. So as you already guessed, the process is fairly complex and complicated, and we have committed to really align with the direction that have been given down by the province to use the best available data and resources to inform the sequences within these phases specific to City of Hamilton. To be consistent, regardless of the, for example, sector of healthcare workers where they're working, whether they're working in hospitals, long-term care homes, or in home and community care, we are committed to have the best possible intelligence from the key stakeholders that are going to assist us for this process through multiple cycles. And all of this is really to provide a promise to public that we are doing this in a transparent way. And we are quite lucky, Kathy, Jan, and I, who have been tasked to work more closely on this, to have a diverse community representations at different tables. And this list is just an example. It's not an exhaustive list. And as we continue through the engagement process, the list is growing, and to address specifically the parts of the prioritization guidelines that ensure equity and fairness. And we work closely with administrative and clinical leaderships from across the healthcare sector. And I am the ethics support for this process to hopefully ensure everybody around this table and beyond that we are achieving and aligning with what province has tasked us to do. Thank you. Next slide. And then you're taking over. Or Kathy.
So, yeah, so I'll just finish this next slide and then over to Michelle. So again, next steps, I heard Dr. Richardson mention this vaccine rollout especially is intensely dynamic, and we're getting used to the cycle of some nuanced updated directions coming from the province very regularly. And I think what's heartening to observe is we see some of the new directions being informed by our local experience. And so it really is a team effort, and everyone really is doing their best to make the ethical, transparent, and sensible decisions to protect those who are most vulnerable, and also to get out of this pandemic as quickly as we can. So that alignment will continue. It is an iterative process. Another iterative process is the engagement with key stakeholders. So the abstract directions come, and then we have to make it real for the city of Hamilton, and we have to make the citizens of Hamilton really trust that everyone's been included in a transparent and fair way. So that community outreach and meeting with small groups and having those dialogues is a process that's happening intensely now and will continue for the next several months. And then I just want to acknowledge too that movement from the abstract guidelines to the real life administration of vaccine is constrained by logistics, and logistics is always improvising in order to support the sequencing and prioritization that is most fair for everyone. So they are an amazing, nimble, and improvisational group. So we're always working step by step the sequencing and the logistical possibilities to get vaccine out. Over to you, Michelle.
Okay, I'm gonna just take you quickly through just a few pieces of information about the vaccine that will hopefully help all of you. So I know that locally and beyond, we've certainly heard that it feels like the vaccine came to market quite quickly, and so perhaps it was rushed. We can confirm with you that the vaccines did go through their full and usual approval process by Health Canada, and they do meet all of the safety profiles. We do know that they do reduce illness due to COVID, but we're still looking for evidence to support that they actually stop people from transmitting the virus. What that means for all of us is that right now the public health measures do remain critical. So wearing a mask, maintaining physical distancing, hand washing, and of course, staying home if you have any symptoms continues to be important. We also know that both the Pfizer and Moderna vaccine require 2 doses for full effectiveness. So you'll know I mentioned earlier that those individuals who received their first dose in December at that just around the holiday are receiving their second dose this week. The vaccine is an RNA vaccine, and there's a bit of concern that perhaps it may alter their DNA, and in fact, that's not at all the case. The vaccine doesn't alter your DNA, and that the side effects of the vaccine we've been seeing to date, although there are usual side effects, they're certainly not worse than COVID itself. And when we talk about what those side effects are, they're very much like usual vaccine. You might experience some pain or swelling, redness at the site. That's just your body's system building immunity, which is what we want to see with a vaccine, that your body does respond against the vaccine in order to prepare yourself should you be exposed to the virus. With respect to how I decide whether or not getting the vaccine is right for me or right for my family member, really it's important to get informed and get informed from credible sources. We've certainly been, like I said, doing some work in Hamilton locally around addressing vaccine hesitancy. Part of that is supporting caregivers and healthcare providers as well in order for them to help others in making that decision. The vast majority of Canadians agree that, vaccination is important, and public health does recommend that anyone who's eligible to receive this vaccine do so. But certainly it's important to ask questions, speak to medical experts, speak to your family doctor or healthcare provider, and have your questions answered.
So perhaps I'll jump back in. So thank you very much. Those last few things that Michelle shared are just a snapshot of the amount of information that is available on our website, which is www.hamilton.ca/COVID vaccines with an S. And so there is a lot of information that has been loaded there, and of course also being developed and shared with those specific subgroups that you've heard lots about over the last little while. We know that tailoring the information to the particular groups that are being considered for vaccine is very important. And so there is work going on across the province, and we're working on that locally as well. And that's why those stakeholder groups are so very important as well, because they ultimately become the champions and those that are able to really tell us what is most important for those that are being considered for vaccination next. Mr. Mayor, with that, I'll turn it back to you in terms of questions that people may have. But again, thanks for going through all of this information with us, and I'll just take down the PowerPoint as well.
That's great. Thank you very much. And, very, very important that we have credible information. I think people ought to go to credible sources for their information, and I know you've provided a list of them on the website. Social media isn't a good one. Credible sources like our city website or the Province of Ontario's website and a number of others, I think, in terms of vaccinations and vaccine is critical that we instill confidence in people that this is the right thing for them to do. So anyway, thank you for all that information. Clearly, the teamwork associated with all of this is evident both on the administration side as well as getting this delivered, and no small feat. And certainly the supply continues to be the overriding issue that prevents wholesale vaccinations, and certainly that supply is starting to ramp up as we speak. So good news, but the bottom line is that we're going to have to ask our citizens to be patient in the context of increasing cases as a result of Christmas and gatherings, and at the same time the promise of a vaccine certainly makes for some agonizing decisions around who gets it first, but I think prioritizing as they have, I think, is exactly the right thing to do. I don't think anyone would argue that our long-term care residents and staff and frontline healthcare workers shouldn't be the first to get this vaccine. So I think we're spot on that. And then we certainly would encourage additional supply to come forward as soon as possible. That's not a question. That was a statement of appreciation for, I know, it has been very, very difficult work to get to this point. We do have a speakers list for questions, and it is Councillors Pearson, Ferguson, Johnson, Nan, Partridge, Wilson, and Jackson. Starting off with Councillor Pearson. Go ahead, Councillor.
Yes, good morning. Thank you, everyone. Excellent presentation, lots of information, and I'm glad the presentation is going to be provided to us as well, so I can go over it again and review everything, because it's once to hear it all and then just to have it absorb and dissect it a bit. But I guess my question, I apologize if I missed it through the process, but I understand that, just pulling up my sheet of the pages that I noted, that technically it is the province that determines how the rollout is going to occur. Is that correct, Dr. Richardson? And who gets the vaccines first?
Through you, Mr. Mayor. Yes, that's correct. So they have given this prioritization framework, which is those phases that you saw. And then within those phases, they have been giving us additional guidance as we go through those and setting targets and timelines for doing that. Once a vaccine becomes more plentiful, it probably won't be quite as specific as we go through. It will become much more a general approach. But at this point, there's a lot of direction specifically from the province, and then the team that you heard about, in consultation with all the groups, the stakeholder groups that they're working with, are deciding how to move forward within those frameworks. So the biggest decisions get made at the provincial level, but we're still working with all the partners to make the final decisions. For example, between long-term care homes, which one will we try to do first?
Right. Okay. And I appreciate that, because ironically, it was a timely call that I received this morning from a senior that I've known for many, many years, who's recently moved into the Amica retirement nursing home on King Street in Stony Creek. I guess he is in the townhouses. So I don't want to be specific, but he's in the townhouses, but still gets his meals through the main building, which is the nursing home and retirement home on the top floors. I guess they're being told that they are not going to get the shots in conjunction with the main building itself. So the concern he has is obviously there will be no interaction now between the residents in the townhomes and the residents in the main building. So how are we rolling this out where we have the different sort of developments within one? So you have nursing home, you have retirement home in a main building, and then you also have townhouses, which are seniors who receive care from the main staff. How is that being dealt with?
Thank you.
So I'm going to ask Michelle, Mr. Mayor, if she would to speak to it. Their group has been working through the sequencing of long-term care homes and high-risk retirement homes.
Yes, so through you, Mr. Mayor, this one is one of the challenging ones, Councillor, where it is a complex environment there. I can assure you that both the retirement home and the long-term care home are arranged to have vaccine for this week. Those townhomes where it's independent living right now are not yet eligible, but certainly one to consider.
So would we give them the tertiary priority, subject to the availability of, say, the Moderna vaccine coming in the next bit?
So the Moderna vaccine coming in over the next bit is still focused on the high-risk retirement homes and long-term care homes. I wonder, Jen or Kathy, if you've had any thought on this particular piece?
Thanks, Michelle. I'll start and then I'll see if Dr. Kalachevich or Dr. Risden have any comments. I think it's a good question, Councillor Pearson. So through the mayor to you, Councillor Pearson. What we're doing is establishing risk within our priority population. So I think the key message back to those types of questions is that everybody who wants a vaccine ultimately will get one. Right now, what we're talking about is sequencing and timing. And the sequencing and timing is dependent on the type of vaccine and how much we get in our community. So as Michelle has indicated, those homes where the infrastructure support and the activities within the home support greater spread, we are doing first. And so, of course, our seniors are at an at-risk population, and they will be prioritized and sequenced relative to the risk to them. So not right now, but through a process. So Dr. Kalachevich or Dr. Risden, anything to add to that?
The only thing I would add is I think that's a great, excuse me, through you, Mr. Mayor, to Councillor Pearson. I would just say that's a great example of the kind of consultations we're seeking and eliciting too, because that description of the three kinds of settings under the umbrella of Amica is different than a lot of other homes. So as Jen has said, it's really clear the long-term care residents and the ones in the retirement home are clearly prioritized. And now we have this group that we're just learning about. So we'll be able to assess their risk and report back a way that it makes sense to prioritize them sort of fairly across other people who share a similar risk in Hamilton. So that information is really helpful.
Well, thank you, and that's why I want to raise it, because I mean, I know you guys are doing everything you can and you understand, but recognizing that we have possibly in long-term care retirement homes that are one structure, we now have these new ones coming online where they have a townhouse sort of development right included, but they're receiving the same meals, the same care is being monitored by the staff in the main building. So I appreciate that, you know, I've sort of enlightened you on some of the issues that are being faced out there, and seniors that are really do want to be sure that they're included and that they're not in the midst of, you know, the staff at the main building will have their vaccines, but the ones in the buildings will not, and there is a concern of transmission of potential COVID virus. So appreciate that. One last question. I just want to be sure. So there's 2 doses of the vaccines, and I think we're starting on the second doses already. And that's also the case with the Moderna. Is that correct? And the third vaccine that I understand is in Europe right now. I don't know if it's come out here yet. I can't remember. It starts with A, as
AstraZeneca.
AstraZeneca. Thank you. Is it also a double dose vaccine?
Okay, thank you. That's your time, and go ahead.
Sorry.
Michelle? Oh, you're on mute.
Through Mr. Mayor, sorry, I don't have the answer for that question, Councillor, but I can get that for you.
That's fine. I appreciate that. Thank you very much. Thank you, everyone, for all the work you're doing. And please pass it on to all the background staff. Thank you. Thank you.
Thank you. Councillor Ferguson.
Yeah, thank you, Mr. Mayor. So I'll get the questions out to Dr. Richardson, and she can deflect them over to any of her staff if she likes. But I sensed a huge sigh of relief come over our city yesterday when it was announced you're starting to get into long-term care and retirement homes. And it was particularly exciting this morning to hear you say that by January the 18th, they'll be all finished. And so that triggers on, as Councillor Pearson said, to a next level. I'm starting to get emails from children who have parents in their 80s and 90s, but still living at home. Will they be done in phase 1, that category?
Through you, Mr. Mayor. So the prioritization and sequencing is, as you've seen, laid out, and it begins with people who are living in congregate settings because they are at the higher risk. It then moves towards the latter part of phase 1, moves to adults who are living in the community who have chronic care conditions. And so a number of people who are over the age of 70 are going to be in that category, though of course not all. There is ongoing discussion about where adults who are older fits into the framework. And so that's part of the nuances, as Kathy has talked about, as this framework moves forward and as the province makes its decision. The age categorization vis-a-vis the chronic health condition categorization amongst those who are living in the community is something I expect we'll continue to see more direction on. But at this point, they're not in these early weeks of sequencing, and we'll be looking forward to hearing more from the province and looking at where they would fit in the subsequent weeks.
So that last line then is over 70 with chronic diseases then?
I believe it's over 65.
Okay, I saw it on the slide 70, but 65 is even better if that's what it is.
I'll ask one of my colleagues to correct me if I'm wrong.
I just don't want to take any more of my time because the mayor's going to be cutting me off real quick. On slide number 15, it showed 50% of the outbreaks are either long-term care or retirement homes. So starting next week, should we start to see a 50% reduction once the long-term care home are all vaccinated in retirement homes? Should we start to see a 50% reduction in chronic outbreaks?
So this, of course, is going to be the thing that we're all monitoring and looking at as we move forward. And so we know that it's going to take some time for that immunity to develop. So the good news is it does look like it develops fairly quickly, although older residents were not, of course, the ones that the initial vaccine trials were done on. And so we don't know the immune response specifically in older adults, such as are in some type of long-term care home or retirement home. So it'll take us some time for the immunity to develop as well. We know the vaccine protects against disease, but we're not sure if it protects against transmission. So it may be that we have smaller outbreaks just amongst those that aren't vaccinated. It may be a few weeks before we see that come down. But it will take some time, but we do believe we will begin to see those impacts in the coming weeks, and we'll be watching keenly to see the impacts as we go forward.
And I'm going to be quick if I can. So it would appear, since a large chart of the population that you're doing in phase one is the long-term care and the retirement homes, are going to be finished by January the 18th. Is it not? It just seems to me that we'll be progressing into phase two probably sooner, because you get through the most difficult part by really next Monday.
So when we're talking about getting through them, we're just reminding you that that's the first dose that we're going to go through in terms of long-term care homes and high-risk retirement homes. There is a second dose that the system needs to give out. Right. Also in that phase two are healthcare workers. There are the retirement homes and other seniors who live in other congregate settings. And then there is, and Nin has corrected it for me, it's adults who are recipients of chronic home care. That is the characterization of that third group. And so that is also a group that's going to go through, and then we'll be moving into phase two. So there is a fair amount of population and those two doses to get through. The other thing is that we're restricted by vaccine supply. And so while we were fortunate to get vaccines start to flow in December, we're not going to see the large volume of doses, as you've heard the Premier and General Hillier say, until April, May, June. That's when we're really going to see the upswing in the volume of doses as more vaccines get approved, such as the AstraZeneca one that Councillor Pearson was speaking to, but also further under the contracts, we'll see more production coming through to Canada and to Ontario.
So you don't think the province has set a policy of under promise, over deliver?
Through you, Mr. Mayor, I think many people think that's a great way to run things, and I couldn't tell you particularly which way the province has decided to go.
That's all my questions for now, Mr. Mayor. Thank you. I think I must be muted, Mr. Mayor.
Sorry, Councillor Johnson.
Thank you. And thank you, Dr. Richardson and the entire team. I can't imagine what your Christmas was like, but I hope one day you get the rest you so desperately need. My questions are not a criticism. They're actually because we went into complete lockdown just prior to Christmas. So a lot of the questions that we were receiving from residents in the initial lockdown back in March, they have resurfaced, but now they've become a little bit more sophisticated, if you will. So my question, Dr. Richardson, is to you specifically, because you stated that the public health is looking at supporting businesses. So this is a question I'm getting on a weekly, if not daily basis, and this is from my own businesses. Appliance stores, clothing stores, jewelry stores, auto parts, homeware, hardware stores are either closed or they provide curbside service. And yet we have Costco's and we have our Walmarts that are wide open, and they supply all those things that are on my list that I just gave you, if not more. So the question, and I know it's not the City of Hamilton's issue, but maybe you can, for the public record, because I know I've sent a few emails to you, why this is allowing the big box stores that sell a variety of things that people can go in and get their hair trimmers, and yet the small businesses like home hardware have to do curbside.
Through you, Mr. Mayor. As you know, Councillor, the policy on who stayed open and who didn't is not ours to make, not mine to make, although there's certainly been discussion about it. And, you know, there's very much, when we're talking about supporting businesses, we did find when we went out and talked to them with the Chamber, with the BIAs, that they were really struggling with understanding all of the guidance that had been given to them and how to implement them. And so we have put a fair amount of effort into helping them in that regard. The piece about the inequities of that sort, of course, is something that has come up. We're all concerned, and you know, you've heard me express this often. We're all concerned about not just the impacts of COVID-19 itself, but also the impacts of the control measures on our businesses, on our overall economics, you know, as well as mental health, overall health. They're all important to us, and so I completely understand the concerns that you're raising. They're ones that have been raised a number of times with the province as they go forward, but ultimately, of course, it's their call from a policy perspective.
And thank you for that. And again, it was just for the public record because I am getting those questions, and I'm sure you are as well. The next set of questions I have are for Stephanie, in particular on slide 14. I don't know where Stephanie went, if she's around.
She'll be here.
Okay. So Stephanie, thank you. On slide 14, you have the workplace breakdown. Have we got or will we get statistics on the workplace and those that have been affected by COVID testing positive? And I'm specific to fast food, coffee establishments, drive-through establishments that apparently are now essential. So these are usually normally low-paying jobs, but they're at great risk at every single transaction that they make. So do we have a breakdown from there as to what workplaces are more affected?
Through you, Mr. Mayor, we don't have a further breakdown on that category.
Thank you. Would we be able to eventually get that all broken down so that we can have a better look at who has really been more at risk than, it may even surprise us, who got the COVID, which career or profession got the COVID and which ones did not?
Through you, Mr. Mayor. I guess I'll preface by kind of saying this all just sort of depends on capacity amongst the organization and things like that, as Dr. Richardson has alluded to. But that's definitely something that I can bring back to the team and something that we can discuss and work towards.
Thank you. And Stephanie, again, this is a question that is a Dr. Richardson question earlier. So I see that daycares are still open. Toddlers like to share their soothers. And then we have schools that are closed. Can you please, just for the public record, explain why one, which seems to be more high risk, is open, but the other that doesn't seem to be as high risk is closed?
Through you, Mr. Mayor, if I may. Steph's role is to do all the epidemiology and the numbers for us, and not to.
No, that's fine. It's just that it was on slide 14, so
yes,
she was presenting.
Absolutely.
Go ahead.
Just in terms of this piece, you know, they're very much trying to look at keeping the schools open as much as possible.
Mm-hmm.
Unfortunately, with the degree of transmission that was ongoing in the community more broadly, they've looked at, of course, extending for the students the shutdowns for the elementary students as well, and they're doing that not so much in the north, but more so down in the south. But everybody's quite aware, of course, as well, that there's a lot of supports needed in order for people to work, and so they're trying to balance all of those different factors that we talked about earlier around health, transmission, economics, all of those pieces. And we know there's a significant strain on parents who are trying to just be the parents that they're used to being. They're trying to do the jobs and do the work that they're meant to do. And now they're trying to help their kids learn as well. And so the daycares and emergency childcare are continuing to be offered so that people can be able to continue to work. And of course, there are some other learning supports, parenting supports programs that are available as well.
And thank you for that, Dr. Richardson. And I agree. And some people argue that a lot of parents treat our schools as daycares as well, so that they can go to work. But we all know that they provide a very essential service. So a big shout out. Thank you very much, Dr. Richardson, to not only your team, but also to all the retailers out there, to all the teachers, and to all the parents that are everyone that's suffering through this. And you just don't realize how much you need something until it's no longer there for you to use. Thank you very much. Those are my questions.
Thank you. Thank you very much. Councillor Nan.
Thank you. Through you. Good morning and Happy New Year, Dr. Richardson and the whole public health team that's on the call today. A few questions on the very thorough report. Thank you so much for it. You had mentioned the transmissible variants and the UK variant, specifically having 9 cases in Canada, 6 in Ontario. Have we had any confirmed cases in Hamilton through you?
Not aware of any of that update, but I'm going to turn to Bart or Nin just to see if there's anything more recent.
You are correct, Elizabeth. Through you, Mr. Mayor, we have not received any known UK variant in Hamilton.
Fingers crossed. Thank you. And next question is regarding the test, trace, and isolation systems. Through you, Dr. Richardson, you had mentioned that we're unable to track community acquired cases at this point, and due to some of the limitations that you had previously mentioned, which I assume are the same ones that go to the social determinants of health data pieces as well. But I was wondering if you could, for public consumption, help us understand what those limitations are, for us from a Hamilton public health perspective, and then what we need to continue to advocate for at a provincial table, given the efficacy of that system working in a flawless way, the tracing, the testing, and the isolation, and also our ability to track that information.
So through you, Mr. Mayor, I just wanted to clarify one point. So when we say we don't have the numbers to give you the data to give you, that's different than the approach to where somebody would have acquired the virus. So I think I'm just saying it slightly differently than you did, Councillor Nan, but I just wanted to make sure for the public they were clear. We don't break down what we do with the cases by where they got it, because of course we don't know till we talk to them. But we do break down by what we do next in terms of where they are at and what risk they pose to others. And so that's where the outbreak management in places like long-term care homes, shelters, daycares, all of those are a priority for us, as opposed to the single cases that may be in the community, or if we definitely continue to see family spread within a home that happens, or amongst people who live in a single dwelling. So that's the approach in terms of going forward, and then the data to be able to share back with you about exactly how many are being acquired what way. That's where we're not able to give you all of that data, and we're not able to do the analysis in order to do that. In terms of what we need to do, we have a tremendous amount of resources that are focused on case and contact management, as well as outbreak management and the epidemiologic supports and logistic supports and the hotline supports that go along with it. And when it comes to this kind of positivity rate, as you've heard me say before, we're really beyond the point where our case and contact management system can keep up. And so the way I would frame it is actually that we're here to support the community in terms of its disease incidence. And it's really the community that determines how fast this disease is spreading by the actions that they take. We have in place a whole set of recommendations in terms of what people should be doing, and what that they should stay home, they should be wearing masks, they should be washing their hands off, and all of the public health measures that we've talked about over time. And if you saw in Stephanie's presentation, she made a shift in terms of how she presented about the ongoing transmission, that there are various factors that are leading to ongoing risky behaviors. Some of that is because people are making a choice. They're choosing to go ahead and do those things, not follow the public health measures that we're recommending. In some cases, it's because of stigma. People don't want to tell people that they indeed have contracted COVID. And this is where we have a subtle balance in terms of how we're talking about COVID and addressing the issues related to it. Because if people don't want to tell people that they had COVID, and so their friend that they went out with or their coworker needs to stay home in quarantine, then we have a problem there as well. And so sometimes, we're finding people don't want to tell us about them because they don't want everybody to know about them, or they may not be wanting to tell their colleagues or coworkers, about their friends or coworkers about it. And in some cases, of course, it's due to structural barriers. There are certainly things that prevent people from being able to take the measures that they need to take in order to reduce the level of risky behaviors. And so that is certainly playing out as well. So when we're looking at these things, really what we need to do is, for people as much as possible to follow the public health guidance that is out there, reduce your risk of transmission in any way or shape that you possibly can. You don't, if you can't be perfect about it, at least be next to perfect about it, if you see what I mean. And, for us all to be, clear about the fact that we want to be seeing as a community our rates come down, and that we want to support each other in doing the things we need to do to bring those rates down, but without ending up having people feel judged or stigmatized as a result of that. And then with those other barriers, a lot of those things are about sick policy, they're about leaves, they're about those sorts of issues, they're about having to have multiple jobs in order to make a living that is that can keep their family and themselves fed, sheltered, all of those sorts of things. And so, those other policy issues need to be addressed as well in order to help to address those structural barriers that are in place for people.
Thank you for that. And through you, Dr. Richardson, it's the structural barriers component that does come through. We know when I'm getting calls and emails from residents who do a lot of the frontline work that's not healthcare related. Councillor Johnson had referred to the retail sector, specifically with food. And then for me, I'm hearing from teachers locally, the educators locally within the ward who live and work here, as well as those who are providing support through our community-based organizations, providing some of those bridge solutions for our residents who are facing the structural barrier as it relates to, let's say, emergency food access, for example, those who are providing the frontline support in terms of harm reduction, those who are providing the frontline support as it relates to shelter services. And so from that perspective, Dr. Richardson, through you, Mr. Mayor, if you could comment on understanding that the province has a role in identifying the target populations, where would those frontline workers who are educators, who are our community-based organization workers who are providing frontline support to our most vulnerable populations, where they fit in the schematic of frontline workers? Are they phase 2 or are they phase 3?
Thank you.
Through you, Mr. Mayor, in terms of those groups, I think it's going to vary depending on which of those specific groups you're speaking about. And so we do see in phase 2 mention of people who are in congregate settings and those who support people who are in congregate settings, that they would come in those phases. Some of them may not come until later. Again, it comes back to the piece about the risk of exposure to the virus, as well as the risk of severe disease amongst that group. And we need to know whether or not this vaccine actually does limit transmission as well, because at this point we're not sure. And so that's not, one of the factors that we can strongly take into consideration as of yet. But I am going to turn to Dr. Kelisevich and to Kathy and to Jen to ask if there's anything more they want to add about those subsequent phases of prioritization.
Thanks, Dr. Richardson, and through you, Mr. Mayor, to the councillor, and I'll let Dr. Kilachevich chime in because I see she's taken her mic off. I think it comes down to really following the provincial guidance. We are hearing that more guidance is going to come for the next phases in the audiences that you're speaking to, Councillor Non. So we will likely get more direction on that. And the other significant piece is what have we learned from the EPI data, particular to the Hamilton context this is really going to help us make some of those very difficult decisions. And I do want to reiterate the key message that this is about sequencing. Everybody who wants a vaccine will get it, and this is about how do we sequence it while quantities are scarce, and we are anticipating that quantities will increase. The speed with which that happens will determine how quickly we can open up access. Dr. Kalachevich?
Thank you. For you, Mr. Mayor, Councillor Nunn, the good thing in the guidelines is that the second version actually addressed some of your concerns, that the definition of a healthcare worker is expanded to actually look into settings like shelters that have not been included in the first one. So some of them is slowly being trickled down and included because of the advocacy of groups like yours and beyond that have recognized that this specific illness looks differently in different communities.
Thank you. And then my final question was regarding the numbers, whether it was Stephanie or anybody else from the team. Previously, we had heard about where our numbers were at was as it relates to our shelter and homeless population. And I know that we're not able to track the same SD demographic information, but is there any sense of how our shelters are faring? My sense from the operators is that they're doing well, and they still haven't seen any locally within the ward. I don't know what the situation is citywide and in other wards. So if I could just get a quick comment on rates of cases related to shelters and our homeless population. Thank you.
Thank you, and that's your 5 minutes as well, or actually beyond, but Dr. Elizabeth, go ahead.
I'm going to turn this one over to Nin to answer as he's to continue to lead the outbreaks portfolio.
Thanks. Through you, Mr. Mayor. I would agree with Councillor Nan's impressions. Right now, shelters are doing relatively well. I may have to look in terms of the specifics. Yeah. They're generally contained and isolated with generally one staff case, that type of thing, but certainly more than in wave one. But I'll follow up. But certainly nothing of significance compared to what we're seeing in long-term care or retirement homes.
Thank you.
Thank you.
Thank you for the responses and the time.
Thank you very much. Councillor Partridge.
Yes, thank you, Mr. Mayor. And Elizabeth, thank you so much. These reports are fantastic. And, you know, again, it's been just reiterating what's been said before, but I really appreciate all the work that staff have put into this. It's very helpful. Thank you. Very helpful. So I have a couple of questions. The first one, the COVID guidelines and bylaws.
Oh, yeah.
That,
I was wondering.
hello? I think somebody else has got their mic on. Anyway, at the Waterdown skating loop, especially this past weekend, we've had a number of complaints. In one case, out of the 25 people on the rink, there were between 9 and 14 people from Burlington. And my residents were particularly upset because they were skating around with their Burlington hockey team t-shirts on, shirts on. And I guess this is more a comment than anything, but I really would like to know if there is any way that we can do something about crossing jurisdictions to use our facilities when our residents, our taxpayers, have to stand on the sidelines and can't even book space because everybody's booking up so early. So a quick comment on that, if you would, please.
Through you, Mr. Mayor, I think Paul is on the line and he would be the best one to answer that one.
Thank you, Paul. Just a quick one, please.
So through you, Mr. Mayor, the only people that can book the reservations are Hamilton residents. However, we have not stopped individuals who arrive on the day. We do not ask for proof of residency for those that are just arriving at the rinks, but for those who are reserving online, it is for Hamilton residents only.
So I do appreciate that, and it may be possible that there are Waterdown residents who are booking Burlington folks in, but it's not fair, and I just don't know what the answer is to that. More importantly, I'd like to ask Elizabeth or any of her team that could answer this about the vaccine rollout, particularly with our migrant workers and our farmers in the rural community. You know, many of them have very large farms. We're dependent on them for food source, especially for milk production. You know, in one case, we have one of the largest operations in Southern Ontario is located in Flamborough. So I'm just wondering what the vaccine rollout, if you could just quickly, because I do have a couple more questions. I'd appreciate an answer. Thank you.
Through you, Mr. Mayor, at this point, they're not in those first phases of rollout. They would be in a subsequent phase, but there's a lot of understanding about both the risk in terms of those settings as there was around outbreaks earlier this year, as well as the importance of them to our economic and our food supply. So not decided at this point, but not in these first few sequences.
Thank you, Elizabeth. I just want to make sure that they're not forgotten, you know, because for the migrant workers, some of them are not being allowed back into their countries. So, you know, they don't have any money. They're not making money right now. The farmers are being very responsible and generous, letting them stay on the farms, but they can no longer send money home to their families, and they also don't have money to buy food. So we have a lot of volunteers in the Flamborough community who are stepping up, ensuring that they are taking food to them. And this is happening not just in Flamborough, but certainly, you know, I suspect in Glanbrook and certainly in Haldimand County, it is a very big issue. I also wanted to ask a question, though, about and I did send this by email and it was answered, but just for folks who are watching, I received another email this morning about a long-term care home in Waterdown where they suspect, have heard that there's a couple more outbreaks and wanting to know how the Waterdown long-term care facilities, retirement homes, and healthcare workers, if they're on that high risk to get the vaccine rolled out. I mean, we have about 7 or 8 of them. You know, that are the homes located in Waterdown, but also Eaton Place in Carlisle and Elm Villa. There's a number of them. If you could please provide an answer for that, I appreciate it.
So this first sequencing does relate to long-term care homes specifically and to high-risk retirement homes. And there are specific criteria for what makes them high risk. So any home in all of Hamilton that falls into those categories, they are part of this vaccination sequence that is going to roll out by January 18th.
And if I understood correctly from previous comments and the presentation, that includes healthcare workers as well as residents.
Through you, Mr. Mayor. So in terms of healthcare workers, the workers that are in those homes, in those long-term care homes and retirement homes, yes, both the workers and the residents.
Okay, thank you very much. I appreciate the answers and appreciate your time. Thank you, Mr. Mayor.
Thank you. Councillor Wilson? Still having power problems, I understand. Has that been resolved, I hope?
Well, it is for this moment in time. So I'm sure, I think some of my questions have been asked and answered. I was going to focus on a concern I had with the comment that some of the more detailed social determinants are not being collected at this time. I'll watch the tape. I do hope, Mr. Mayor, that this regrettable situation will really lend itself to a really deep conversation nationwide, Hamilton and provincially, on some of the policies that we need to be discussing. Because to say to a worker to stay home if you don't have any symptoms when they're not going to be compensated to do that, we can see that it has an impact for all of us in the community. So I hope we'll have a nationwide discussion about sick pay, and we can have that discussion even with the Hamilton Chamber. Those structural barriers have an impact on all of us. I do have a specific question to a statement that was made that when someone is in isolation, we're ensuring that they get what they need. Just to Dr. Richardson, what does that mean and how do we do that?
Through you, Mr. Mayor, perhaps Nin or Bart or Michelle would like to address that one.
Happy to do that. So through you, Mr. Mayor, to the councillor, we do have a process set up using both city staff and in some cases it's agency. And if there are individuals who are not able to get out on their own through their family, through friends, whatnot, we do have the ability to ensure that they get, needed groceries, medications, that kind of thing. So that process is in place, and the nurse who's doing the case management basically connects through the appropriate chain. Depending on what the need is, would depend on what agency or whether it's through city staff. And we reach out to ensure those vulnerable people get what they need.
Thank you.
Okay, thank you, Michelle. If I could go back, if I may, if it was asked and answered, please let me know, Chair. The collection of the social determinant factors, Dr. Richardson, could you unpack that for me? Why we're not doing is simply that of human resources, because that is concerning?
Doctor?
Through you, Mr. Mayor, it is entirely due to human resources and not having enough resources to do all of the work. And so, we've got lots of more resources than we had, but unfortunately, we have more cases and more outbreaks than that group of staff can support in terms of doing all of the case investigation. It takes about 3 hours to do a full case investigation on a single case, and then you need to follow up with the contacts and follow those people over time, over a 14-day period. So it's a significant amount of human resource investment, as you can see, to do each of those. And then each of the outbreaks requires a lot of intensive monitoring. So unfortunately, we've had to prioritize using that framework that we showed you earlier in terms of what it is that we do and looking to maximize our impact on transmission. And so that has meant that we've ultimately not been able to collect all of the data that we had wanted to, and that includes the social determinants of health data. That also means a number of other data points as well, and that we're not doing all of the follow-up on all of the cases. Our focus is on those in high-risk settings and on outbreaks. So it is exactly that. We've discussed, at some point, would we be able to hire a student and be able to look back and do what we had done with the early cases in the course of the pandemic. But at this point, we're not sure that's going to be feasible because of the rollout of vaccines and all those things that are going to go on. So we will continue to hold that in our minds as something that we may do as practica come forward and students come forward. But at this point, we can't commit to doing that.
Thank you. Councillor?
I just want to make sure I understood that last point. So you're saying subsequent, say we're all done this experience, it's not determined yet that you can go back to the data to have a reveal of the social determinants.
Through you, Mr. Mayor, just to note, a number of the social determinants, such as place of residence and those sorts of things, do routinely get collected and will continue to be collected. So it's not all social determinants. It's the added questions that were being asked, for example, about racial background, ethnic background, those sorts of things that are not being asked. So I think the point about will we go back to those cases months down the line, potentially a year down the line, and ask those people about that data, that's something we're going to have to consider when we get to a point where that might be possible. It may be very difficult to follow up with those cases. It may be very challenging. And the other thing we do know is that that data has been fairly stable. It's pretty well established, the patterns and who it is that's being affected, and we want to act on that, as you heard, with the epidemiologic work, the vaccine allocation. Those factors are being considered within it. So it's not that we're not acting on it. It's not that we're not doing something with the data that we've already acquired. It's simply a matter of health human resources and ultimately whether people will want and will be able to follow up with people months to years after the fact.
Thank you. Councillor Wilson.
Well, I have not read the ethical framework for the vaccine distribution. I'm just having a difficult time trying to imagine how we are going to inform our future equity policy and our own ethical obligation in the absence of that. If we know that there is certainly a racial component and an income component to those who are most vulnerable, then certainly that, in my opinion, should be informing our ethical obligations. And in the absence of that ongoing data, I'm really at a loss on how it's going to inform that framework and inform the kind of rigorous public policy and public health debates I think we should be responsible for having. So thank you.
Okay. Thank you. Councillor Jackson.
Thanks, Mr. Mayor. And I'll only have one question at the end, but I just have a few comments right off the top. These last 24 hours, Mr. Mayor, is a message of hope. And on behalf of my constituents, the senior and frail elderly population of our community, this is a wonderful 24 hours announcement that we've heard about rolling out the vaccinations into our city and especially into our long-term care facilities and those retirement homes that are at higher risk. Dr. Richardson, right across your team, thank you very much for the collective efforts, the advocacy, to your directors, Vickers, Manzin, and Baird, and epidemiologist Hughes, and the rest of your medical healthcare team. Thank you very, very much. I must say, Mr. Mayor, you have been, for the last 9-10 months, a calming, steady hand at the wheel, and I sincerely want to commend your leadership as well. There are times when I have sent out some terse emails on behalf of my constituents and myself when I felt there were some inconsistencies, Mr. Mayor. And as you know, one of those inconsistencies was where Hamilton was put in lockdown 5 days before Christmas, which I felt at the time was unfair and unnecessary to be compared to Toronto, Peel, and York. And then to have the vaccination told that we're not a hot spot in terms of over the holidays, that Hamilton would not be one of the first locations, even though we were a hot spot before Christmas, but now suddenly we weren't a hot spot. I reached out to MPP Donna Skelly's office to get a clarification and hopeful consistency. And just across the board, Mr. Mayor, these last 24 hours, I am just so pleased and relieved, especially on behalf of our frontline healthcare workers and our frail elderly population and seniors in our city, that the vaccinations in full steam ahead being rolled out in our community. And for the collective efforts, Mr. Mayor, and kudos to MPP Donna Skelly and the government for listening and realizing Hamilton was in the top 5. There were 4 other hotter spots, if you will, in the province, but we were in that top 5, and now we're getting a serious vaccination rollout in our community. So I just want to say that this is a wonderful message of hope, and I want to stay concentrated on that the last 24 hours. My one question, Dr. Richardson, through you, Mr. Mayor, I know a number of families who have loved ones in nursing homes, and they are asked if they wish to designate one member of that family to be the primary caregiver for their loved one in the nursing home. I want to ask you, Mr. Mayor, to Dr. Richardson, will that primary caregiver be considered a prioritization in terms of the vaccination, along with the seniors, along with the healthcare workers? Through you, Mr. Mayor, to Dr. Richardson, please.
Thank you.
Through you, Mr. Mayor. Yes, this first wave of vaccinations in long-term care homes and retirement homes includes the residents themselves, it includes all the staff that work in those homes, and it also includes the essential caregivers who come in to give care in those homes. So these are the caregivers that have been registered with the province, and those are the ones that are vaccinated along with them.
That's wonderful news, because a number of families have asked me, they've been asked to designate a primary caregiver from the family, only one, and I've had some questions over the weekend as to will they be given the vaccination as well. Mr. Mayor, I have other questions. I've been critical at times of the Ford government, but the last 24 hours, I want to stay with this message of hope for our community and thank everyone, including yourself, for helping us get to where we are today. Thanks, Mr. Mayor. Thanks, Dr. Richardson.
Thank you very much. Much appreciated. Councillor Danko.
Thank you, Mr. Mayor. 2 sets of questions for Dr. Richardson.
The first, as was mentioned in the presentation, is the province is announcing new modeling coming soon, and the premier has mentioned that it's looking pretty severe, and I think scary is the word that was used. I think it's being reported now that what we're expecting to see in some of that modeling is up to 6,000 cases by the end of January. Large portions of Ontarians who were not following basic public health guidelines, and also mobility data showing that there was extensive travel and shopping and visits between people just before Christmas and just before the Boxing Day lockdown came into effect. So people knowing that there was further restrictions coming and using that time to visit and travel and further spread the virus around. So here in the city Hamilton, we've led the province in many areas, thinking back to the beginning of the pandemic, where this council instituted bylaws and penalties for for lacking of physical distancing and gatherings. We led the province by putting in a mandatory mask bylaw in advance of provincial guidelines. And I'm just wondering, through you, Mr. Mayor, to Dr. Richardson, if this is another opportunity for us as a city to close some of those loopholes that we know exist right now. Councillor Johnson mentioned a number, with the big box stores. I believe there's already a motion on the table to review that. It was moved by Councillor Vanderbeek and Councillor Partridge prior to Christmas. And again, just wondering if there is an opportunity to, if we know that leading up to further restrictions, people take advantage of it, if we should be acting faster and act now.
Through you, Mr. Mayor, that's a good question. I think you have definitely noted the number of times that we have moved a little faster ahead than perhaps the province was, and that included when we didn't go into lockdown. We did go forward with additional measures at that point because of those concerns that we're talking about. I think my advice at this point would be that we're only 2 days away, I think, at most, from the Premier making his announcement as to what he plans to see, and we've heard from him just how grave he sees things as with these projections. And so I think it would be difficult for me to say where there are specific issues. We know, and I don't know if Bart wants to speak to it a little bit, we know from working with looking at purchasing this additional data in terms of projections, that we do have higher levels of mobility. For example, in Hamilton, we're on the upper end of that scale for whatever reason. And so some of the things that they're looking that need to be changed, I'm not sure how many more municipal levers there are that can address those specific areas. I think there are, those things like equity around big box stores versus smaller retailers, those kinds of things. We'll see how much there's still an issue, I think, in a day or two, and then perhaps the municipality could decide to move forward with some additional pieces in order to enhance the equity of those or to close particular loopholes. But at this point, it is the broader following of the public health measures. It is this choosing to stay at home. It is those issues, along with those structural issues like not having sick time, not having paid medical leave, which is leading to people going to work when they shouldn't be. So I wouldn't say there's particular things to do right now.
Thank you, Dr. Richardson. And I think, considering that it is just a couple days away, and then looking at what the province, institutes in terms of further policy, and then augmenting that as we feel necessary locally. So appreciate the answer on that. Just one other follow-up kind of couple questions on the availability of doses of vaccine versus administration of vaccines. So I've been hearing quite a bit of anxiety from the community about this. There's a lot of reporting of the number of doses that have been delivered by the federal government versus the number of doses that are in freezers versus the doses that are being actually administered, and getting those vaccines out of freezers and into arms as quickly as possible, and kind of the rate of vaccination that it'll take in order to vaccinate everybody. Clearly, the message of hope that Councillor Jackson stated about getting all the long-term care homes, retirement homes, high-risk staff and residents vaccinated, that's just a massive relief, for me personally and for our communities. It's something that it's clearly been a huge concern for people throughout the city. But just on moving forward, on kind of the availability of doses versus the doses that we have locally versus because there's some complexity to it in terms of the second dose versus getting out to everybody versus the total number doesn't necessarily tell the local story. So maybe just give you a chance to expand on that.
Doc, and that's your 5 minutes, sir. Thank you, Doctor.
Thank you.
Through you, Mr. Mayor. So yes, this issue of the vaccine supply and our ability to get it in arms as fast as we possibly can. I can tell you that the team at Hamilton Health Sciences, the team that is contributing from across the community at that site, and as well as contributing now into these mobile clinics that we're leading into long-term care homes and retirement homes, they are doing what they can with the resources they have and the supply of vaccine that is coming in. It is coming in. We had the initial supply before Christmas time, and then there have been shipments that have been coming now on a regular basis, but small amounts in order for us to meet those priority groups. And the province is very much with the small amounts they're receiving, because we're still in this phase of constricted supply, that they are trying to get it out across the province. And we know there's a lot of clamor about, even neighboring jurisdictions like Niagara that are having severe outbreaks, and they're not getting their vaccine until this week. And so it's just everybody's, trying to do the most they can with the vaccine they have, but everybody needs more than we have. As you heard from this group, everybody wants it and needs it more than we have. So we're continuing to work with the allocations that the province is giving us and getting them out into those priority groups as soon as we can. There are a lot of logistics behind this. Putting a needle in an arm is not that hard, but all the things that get to the point of being able to put a needle in an arm are very challenging. They're everything from, finding sites, finding staff, making sure with these new vaccines, we've got consents, information. We've gone out and talked to people in advance so that they know what it is that they're being asked to do. It's finding, making sure we have the right PPE for people to wear. It is making sure that that all of those things are in place. The transportation has to be very careful with these vaccines. They're fragile. The inventory control, the counting, the getting it back into data systems so that we can measure and be sure and make sure we know, did somebody get a first dose of Pfizer or a first dose of Moderna? So it is a very complex thing to do. We're working with some systems that the province has put in place very quickly, but they too are being built and improved as we go forward. So I can understand that people very much want to get it out as soon as possible. I can assure you that the team around the Hamilton COVID response table wants to get it into people's arms as soon as they can, and they're working very hard to do that.
Thank you.
Thank you. And sincere thank you for all the hard work that you and your team do. It's very much appreciated.
Great. Thank you very much. Councillor Pauls.
Thank you. And I always want to be grateful as well, so thank you. Doctor, can I ask you a question? You mentioned right at the beginning that the vaccine is to fight the disease, but not the transmission. I really didn't understand that, because I had a question from someone, and we're so happy that all the long-term care facility will be receiving the vaccine, and we're so excited about that. And the question was, will the protocol be the same then when somebody goes and visits their loved one? Since they're protected, the loved one goes in, when will the protocol be? Do they have to still get tested?
Thank you.
When will be the time for them to hug their loved ones?
Yeah. Through you, Mr. Mayor, just sorry to jump in, Councillor Pauls, but that is just so much the question for so many of us, right? About our loved ones that we haven't been able to see, we haven't been able to hug, we haven't been able to spend time with in the ways that we would want to. And so absolutely appreciate that question. In these early stages with this vaccine, where we're coming to understand it, what we know is that it does prevent disease. It reduces the risk of somebody getting really sick with COVID-19. What we don't know yet is whether it stops them from getting infected with COVID-19 and being able to pass that along still to somebody else. And so it takes some more time for that to be established as this goes forward. So we will know, we just don't know yet. And so at this point, while we're in the phase of not knowing, everybody needs to still follow those public health measures, still keep physical distance, keep wearing PPE, and yes, the testing for now will continue in terms of the long-term care homes and the visitors to long-term care homes. So the good news is that we're reducing the risk of severe disease, that we're going to get some information in time about whether or not it stops transmission, and that will allow us to make further changes as we go ahead.
And doctor, do you have a timeline when we will know more? Because as we're giving these vaccines, there's so much hope, and yet we're still being stopped by doing everything, you know? So what's the timeline, if you can think of, if you know?
Through you, Mr. Mayor, I don't think we know the answer to that question. That's going to come from the science, and it'll depend on how clear it is. It'll depend on how many studies are done in how many different groups, because it does behave, vaccines can behave differently at different ages and in different groups. So it's going to take us some time to get there. And this is, you know, when we, and I know you know this very well, Councillor Pauls, because you enact this every day, but when we're thinking about resilience as a community, it is really important to focus on the things that we are getting to do better. There is going to be a light coming down the as we go forward and more information, but we are going to need to continue to be patient while we wait for that.
Okay, I have one more question, and I don't know if it's a rumor or whatever, but I was told by someone that paramedics are not in phase 1 nor 2, and because the province said that they weren't essential. Is that true, or am I hearing some false statement?
Through you, Mr. Mayor, there's certainly been lots of discussion and debates about, I think, every single possible group that there is out there, and that's certainly what our group finds as they go out and do the work. They understand about who all the different groups are at different situations, as you heard today in the discussion about Amica and how it is set up. When it comes to healthcare workers, and paramedics are included as healthcare workers, they are included in that first sequence of healthcare workers that will be vaccinated. So we do already have some vaccinated who are working in our vaccine clinics, and they will continue to be vaccinated as we go forward in conjunction with our other Priority 1 healthcare workers, both in the community and in the hospital. And so that is where you'll see that roll out. Sometimes I think that people do get confused because of the term first responder. And of course, we use that term more broadly to mean fire, police, all of those groups. And those groups aren't right now in that healthcare worker group, of course, as you've heard, and they would be sequenced later at this point in time. But these are all groups that, you know, this is the piece that Jen has said so often this morning. Everyone is going to get vaccine. It's just a matter of sequencing it. It's a very difficult decision to make in terms of who is sequenced before another, because, you know, there are many good reasons. And so we're going with the prioritization framework from the province. The ethics are so important as we go forward, the epidemiology, all of those are being considered at the provincial level and at the local level, with a focus on reducing the number of deaths in our community.
I find it ironic. I have a daughter-in-law who's a nurse, and she just got vaccinated. I have a son, her husband, he's a paramedic, and he's not vaccinated. So it's in one family, we have one that's vaccinated and one that's not. So I can't wait for the day that we all can get vaccinated. So thank you, doctor.
Thank you. Councillor Nan, second time.
Thank you. Through you, Mayor, to the rest of my Board of Health colleagues, I guess one thread that I do want to pick up from today's conversation and deliberations is on the structural barriers component. And Dr. Richardson, you mentioned paid sick leave very specifically. Many health researchers are helping frame paid sick leave at this time as being a public health measure, especially during infectious disease emergencies like the pandemic that we're in right
now. And my colleagues will also remember through the Task Force on Economic Recovery, one of the recommendations was also to advocate for paid sick leave. And I think at some point there was even a deliberation among that table to define the paid sick leave at 10 days. And so for consideration for my colleagues, I don't know if it's a notice here for the Board of Health or whether it needs to be through the General Issues Committee or whether or not through the Economic Recovery Task Force report that we did receive at the end of the year, whether we did approve from Hamilton an advocacy to the province for that paid sick leave. It's also my understanding that the Toronto medical officer is putting forward a recommendation to the province advocating for 10 days of paid sick leave as a health measure. I guess it's for deliberation for my colleagues here at Board of Health, but also potentially at Council. Mr. Mayor, do you recall whether the recommendations from the task force that we moved at the end of the year at GIC included the 10-day paid sick leave, or if that would be appropriate to do so through the Board of Health?
Thank you. I don't recall it said 10-day. I think paid sick leave has been advocated for by us, by the Medical Office of Health, by the Greater Toronto Hamilton mayors, and we'll be doing it again today at our meeting at noon if I can get to it. Once again, advocating for paid sick leave for folks that are ill that shouldn't come to work, and so that's been an ongoing advocacy. I think it would be helpful to do it through the task force. Quite frankly, I think that would be the appropriate way to add the 10 days. I mean, the advocacy, the days, the specifics around that. If there's more specifics to be had, might be helpful to do it through the task force. But I'll leave it in your hands.
Thank you for that clarity. And I think that the piece that I really want to make sure gets integrated in is that it's not only an economic recovery recommendation, it integrates a public health measure, which our doctor has also has indicated as being a structural barrier and would be a public health measure that would increase our overall health equity in this pandemic. Thank you.
Totally, and that's the way it's been presented. Beyond just economic issue, it's actually a public health issue that prevents further spread of the disease. That's the whole point. So people that are sick shouldn't be coming to work, and if the barrier for them is they lose a day's pay, that's a detriment to actually protecting public health. So that's the way it's been portrayed and advocated for.
Excellent. Thank you.
Great. Thank you very much. Thank you all very much. As I mentioned to you in an email a little while ago, the complexity of beginning of this year, as difficult as 2020 has been, it is going to be a very challenging, difficult 2021 with the ever increasing cases for whatever reason, and we need all of you to be part of the messaging to continue to advocate for physical distancing and masking, even though people have had the vaccine, doesn't assure that they can't be a carrier. And so those messages have to come from us collectively. I think we need to be together on this. We're in this together, and I think our collective messaging is going to matter. And to encourage people to get well informed on the efficacy of the vaccine, the safety of the vaccine, the knowledge that many millions of people have already had this vaccine with minimal, if near to none, negative, serious negative impacts, other than the usual shoulder pain and feeling a little off for a day. That's a normal reaction for an immunization shot. So collectively, we are going to have a very, very challenging time, and I think more than ever, it is important that we communicate. All the questions that you've asked today, the answers that have been given, can be delivered to your constituents. Hopefully we can get that to them sooner rather than later so that they can have the confidence that we're doing as much as we can to get the vaccine into the arms of all individuals in our community, but it needs to be done based on supply on a prioritized basis, and that we all at one point want to be done with this virus, but we're not there yet. And so even though vaccinations are happening, public health requirements are still going to have to exist. And hopefully we can all share that message so that we can continue to provide equity in our community. In terms of who's responsible for what, as you well know, the decisions in terms of lockdown and what's open and what's closed is solely in the hands of the province of Ontario. And we can we can't change their recommendations, and if they decide to go with a curfew, which I hear now rumblings about, that again is solely the purview of the province of Ontario, not the city of Hamilton. And there's some confusion around what we're authorized to do. Most of the recommendations that we're following on and enforcing are requirements and regulations that the province of Ontario is passing. That is not to pass the buck; it's just the reality of it, of the way it's working. And in terms of implementation for vaccine, I think our staff have done a terrific job of getting us to the point where we have now a broader expanding opportunity to take a vaccine that was originally thought to be only capable of being housed in one location and make it portable and do it safely and effectively and get to the Moderna type of vaccination sooner rather than later. And I think that was an innovation and a clever approach on behalf of our public health staff to get us to that point. So innovation and the effort, we all want the effort to be get it in the arms of individuals as soon as possible. But the prioritization of that is going to be messy and complicated. And the next few months are going to be a challenge given that the increasing cases. So we're all in it together. We need to see our way through this. We need to communicate as much as humanly possible that the vaccine is safe, and as much as possible encourage people to be patient as we work through this process, because it's going to take some time to get done. Dr. Elizabeth, thank you for all of your work to date, including your entire team. I'll be sending an email to them later. We will continue on with the very important work of trying to keep people safe in our community. I need a motion to approve the receipt of the presentation, please. Moved by Councillor Pauls, seconded by Councillor Vanderbeek. All in favor of that, please, a vote electronically. While we're waiting for that, I know Public Works is on at 1 o'clock or 1:30, I believe. 1:30, thank you. Anyone unable to vote? Councillor Pearson, thumbs up, thank you. Councillor Collins, thumbs up, thank you. And that is carried, thank you. Moving on, 10.1 is the Hamilton Family Health Team secondment. Jen Vickers-Manson, you're here to speak to this. Jen, you want to speak to that now?
Thank you, Mr. Mayor. This is a report that we're bringing forward. It's a recommendation for the end of a secondment that we've had with Hamilton Family Health Team for the funding of a 0.5 PHN. It's been in place since 2011. And the purpose of this secondment was to build and strengthen our relationship with the Hamilton Family Health Team to support healthy growth and development in children and families. And since that time, we have established a strong working relationship with our Hamilton Family Health Team, which has only been strengthened throughout our COVID response. They've built some internal capacity to take this on internally, and we will continue to work with this agency and these partners very quickly. So for them, this represents a cost-efficient way of continuing with the same amount of work while we continue to work together moving forward.
Okay, thank you. Any comments or questions on the report? Councillor Ferguson?
No, I just want to move it.
Okay. Violent support for reduction in FTEs. Moved by Councillor Ferguson, seconded by Councillor Johnson. Any other comments? Not seeing any. Let's go to the electronic vote. Thank you, Jennifer. And ability to vote for Councillor Paul's able to. Yep, all in. Thank you very much. That's carried. And the outstanding business list, some modifications and changes were made. There's nothing more to deal with on that, I believe. So the modifications and changes are before you, revised due dates. Any comments or questions on it? If not, I'll take a motion. Councillor Wilson, a question or a mover?
I can do both, but I just would like to express a comment. We've talked today about the exhaustive and exhausting work of our public health. There is an item in the outstanding business list that had to be pushed, understandably so, given the focus. It's 13.1A 5.d, municipal actions to reduce harms associated with alcohol use. I began my series of questions this morning on the Government of Ontario's, before the COVID move to cut public health funding. The aftermath of this pandemic is going to require just as many resources. There is anecdotal, and you're seeing increasingly physicians noting the rise in alcohol use during this time. And has serious implications on a number of fronts, physical and social. So I just would like to make that political plug that even after COVID, public health and the maybe unintended consequence of the pandemic are going to require a steady hand and continued resources. Thank you, Mr. Mayor.
Absolutely true. Thank you. And I did hear you indicate a motion to approve the altered dates in the outstanding business list, seconded by Councillor Jackson. Any other comments or questions? All good. Thank you. Let's have a vote on the outstanding business list changes and amendment. Favor or opposed? Votes coming up as soon as they get it up. There we go. That's carried. Thank you very much. And thank you all very much for your attendance this morning. And as we join 2021, let's support one another, be kind to one another in the broader community, be patient, and do everything we can to help ourselves get through this very, very challenging COVID-19 pandemic. Thank you all very much. Motion to adjourn, moved by Danko, seconded by Barula. All in favor, one electronic vote to go. And it's up, and it's through the uprights. A little football vernacular for you. Any chosen teams, any of your favorite teams win yesterday, Tom? All in, that's carried. Thank you very much. Public Works this afternoon. Have a good lunch. Bye.